Asthma is a chronic disease involving the airways. When triggered, the muscles around the airways become so tightened, making it extremely difficult for air to move in and out of the lungs. Today, we are going to have an intensive discussion with Dr. Salako on how to manage this condition. My name is Edak, Willie. See you shortly. Welcome back. Dr. Salako, welcome to our program.
Thank you very much.
Please tell us more about yourself.
Okay, my name is Dr. Helen Olubumi Salako. I work as a medical doctor in APIN program, LUT site, Idiaraba.
Okay.
I'm a medical officer. I've been there for years.
Thank you for coming.
Thank you. Thank you.
Today we want to talk about asthma. What is asthma?
Okay, asthma is a chronic disease of the lungs, of the airway, in which there is airway hyperresponsiveness and chronic inflammatory disorder affecting the airway. Is
it hereditary?
Basically, it's heredity. Genes play a major role in asthma. So I can say it's hereditary. That is why a mother can pass it to a daughter, and a father can also pass it to his son.
But so one cannot get asthma. It has to be hereditary.
Not in all cases.
Okay.
There are people that don't have history of asthma in their family, and they still develop asthma.
So in such cases, what activates it?
The environment.
Okay.
The environment play a major role in asthma, because there's also some people that are prone, they have genetic predisposition to asthma. And if they are not put in an environment that can trigger asthma, they might not even develop it. So asthma, so to speak, is hereditary, and at the same time, environmental factors has a role to play.
When you're talking about environmental factors, like what?
They can be classified into three. We have the allergens, we have the air pollution itself, then we have virus. There's a virus too that can be responsible. It's called respiratory syncytial virus. Then the allergens, we have the intrinsic and we have the indoor and the outdoor allergens.
Okay.
The outdoor allergens are basically pollens from flowers, trees, and grasses. Then the indoor allergens like rats, stools, pets, salivas, and especially cats. Their saliva too.
Okay.
Those are examples of allergens. Mm-hmm. Then in terms of air pollution, fumes.
Fumes.
Yeah, fumes from
car fumes or
car fumes. Those are
cooking.
Outdoor cooking. Okay, exactly, fumes. Cooking. Those are outdoor air pollutions from fumes from smoking.
I hear some people that say. Like one boy, the mother said the doctor advised her to remove the rug in her house. That each time the boy was in the house, where the asthma got worse until when they removed the rug. Well, how does that play?
That's an example of indoor allergens, because some of these rugs are artificial, and they are made, the products they are made from can be an inciter or can be an inducer of asthma. To that particular child. So rug, as it is, has a role to play. So that is why some mothers, when they come to us and we ask them, the first question we even ask them is that, do they have rug in their house? If they do, we ask them to remove.
Okay.
And with time, they come back to tell us that the situation got better after they remove.
Is it the same thing, because I know some people that work in a clothing industry where they cut and sew, that they also said, I know of one particular lady that said while she was a seamstress that she stopped that work because that made her asthma worse. What has that got to do?
In that particular incident, I guess what actually triggers the person's attack might have to do with that, and that is called occupational asthmatic.
Okay. Is it from the cloth? Is it what they use in making the cloth?
That's where I'm heading to.
Okay.
Like it might be the materials used in making the clothes. It might even be for instance, if in a season, if they're making wool, for instance, it might be that usually triggers the person's attack. Mm-hmm. So in that case, because that is why as an individual you have to identify each triggers for each person. So for that particular patient, it might be that the material, the wool, is the one sensitizing her.
Yeah.
You know.
So what are the common things that trigger asthma?
Okay, like asthma,
the fumes. You talked about fumes.
I talk about fumes. Okay. People that are already asthmatic can be triggered by exercise if they do
exercise.
Rigorous exercise. Everything is in moderation for them. Okay. It's not as if they can't do exercise, but if they do, if they do a rigorous exercise, they can have exacerbation of asthma. Okay. Then I've talked about fumes. We've talked about passive smokers here.
Okay.
If they smoke, actually they will be advised to stop smoking. But if they don't, they shouldn't be a second-hand smokers. Like, they're also called passive smokers. Like, maybe somebody smoking beside them, they have to get up because they are inhaling the smoke. Okay. Then fumes, like kitchen fumes, when they're frying.
So won't they cook?
Definitely they will cook, but there's a way.
Who will cook for them?
There should be enough ventilation in the kitchen. So as the fume is coming out, it's also going out of the kitchen, so they don't get any asthmatic attack.
You were talking about the types of asthma.
Yeah, the asthma can be divided into 3. Basically, we have the intrinsic one, we have the extrinsic one. The extrinsic asthma is also known as the allergic asthma. Okay. And the intrinsic one, there's no known allergy. We cannot identify any particular allergy given this patient's asthmatic attacks.
Doctor will be right back. Let's take a break.
There's plaque in everybody's mouth. It forms every day. That is why we need to clean daily.
Back pain can be said to be a result of wear and tear.
Yeah, that's
Raise one leg up and then try and pull it to your chest. Your head down. Just relax.
Some of these infections, like particularly like tetanus right now, it's something where if the mother is immunized, the child is actually protected for the first 3 months.
Medicine from your kitchen. Today I want to share one tip with you, how you can use your coconut as medicine. Hi, my name is Edak, Willie. If you want to know how to stay healthy and fabulous, join me every week. Please tell us, what are the symptoms of asthma?
Okay, there are several things that can happen in patients that have asthma, but there are 4 major symptoms that you see. Because asthma as it is a clinical condition, meaning that the patient comes in, tells you that I have this, and as a doctor, you have to use your clinical, honestly, to say, okay, this is it. This person must be having asthma. The patient might have breathlessness, that's shortness of breath, either related to exercise or not. There could be cough, recurrent breathlessness. Then there could be wheezing. Wheezing is when the patient make a hissing sound, when the patient is trying to breathe out, breathe in and out. So when the expiration part is coming on, the patient wheeze. Then the patient also complain of chest tightness. Truly, other symptoms, like there are other conditions that can present with those things. But what makes asthma unique is that the patient will have recurrent episode of all these symptoms I've mentioned. There will be recurrent episode of cough. There will be recurrent episode of chest tightness. There will be recurrent episode of wheezing and breathlessness. And again, when the patient is given a bronchodilator, the patient gets better. Okay. So that makes the diagnosis complete.
Yeah, like, you can now tell.
We are actually dealing with asthma in this person.
Okay, so what's the difference between allergies and asthma?
Okay, allergy is not all the patients that have allergy that will develop asthma at the end of the day. Yes, allergy is the propensity to develop antibodies, especially IgE to certain allergens when they are exposed to. For instance, somebody comes in contact with pollens, rats, stools, cats, fur, cat skin. The way some people will react to it will differ from the way another will react to it. So some people, when they come in contact with such allergens, they react, there's hyper-reactivity.
Okay.
There's hyper...
It's not allergies will be like
hyper-responsiveness.
Okay.
The patient respond, like
immediately you see it. Yeah.
Patient,
Okay. Whereas asthma is a continuous something.
It's a continuous thing. It's a chronic thing.
Yeah.
The patient comes in contact with this the first time. The person reacts the second time, and it now becomes. So some patients with asthma will actually have allergy. Some will not.
Okay.
So they are not the same. Asthma is a clinical entity. It's a disease entity that comes on with chronic exposure. That's a long time.
So how do you diagnose a chronic disease, a chronic asthma?
Diagnosis, like I said earlier on in the show, is basically clinical.
Okay.
In the sense that the patient comes in with history for adults, the patient will be able to tell you this and this is what has been happening to me. There's always a history of recurrent cough.
Okay.
Recurrent cough, recurrent chest tightness, breathlessness, whether exercise reduced or not. And the patient might also be able to identify the inducer or the inciter of the asthma. Like the patient might be able to identify what triggers the episode when it comes on. And that is clinical. Then another thing is that you can also support it with some laboratory investigations, some of which are chest X-ray, although is not diagnostic, except the patient had other conditions like maybe complicated asthma. Chest X-ray is really useful. Then there are other things we carry out like lung function test.
Doctor will be right back. Let's take a break.
Asthma is a chronic disease of the lungs, of the airway.
Smoking also is associated with increased risk of developing hypertension.
There's plaque in everybody's mouth. It forms every day. That is why we need to clean daily.
Back pain can be said to be a result of wear and tear.
Yeah, that's
Raise one leg up and then try and pull it to your chest. Your head down.
Welcome back. Doctor, please, as you were saying.
Thank you very much. We're talking about asthma. The diagnosis is clinical, I said that, and then it could be supported by laboratory evidence, in which you send the patient for some investigations, basically chest X-ray, chest radiograph. Although chest radiograph is not diagnostic, except the patient has some complications like...
but you have to go through all these tests to be able to tell.
Lung function tests, in which we use a device called peak flow meter to measure the expiratory capacity of the patient.
So that you really know what you are treating, not self-diagnosis. Then, doctor, somehow I've done some research that asthma does not have a cure. Is it true?
Yeah, it's a chronic
How do you manage it?
It's a chronic disorder. It has no cure, but it can be managed. It's a preventable disease, and that is what is being geared towards now. Asthma is something that should be prevented rather than patient coming down with it every time.
Okay.
So people are living with asthma, and the goal of the treatment is patient education and self-guided treatment.
Can they have a normal life? Can they lead a normal life?
Sure.
Because I think I've seen somebody with asthma before. Really? When she had the attack, it was so bad
it's usually bad if the patient has a severe one, for instance. But in between attacks, patients are usually normal.
Okay.
Honestly, asthma patients are usually normal.
But can they involve in activities like every other person?
They can, if they are well maintained.
Okay.
And that is why when they have an acute exacerbation, you put them on maintenance dose. After treating the acute attack, you have to put them on maintenance drug. So that for 3 months, for instance, the patient can be symptoms free. So such patients will live a normal life, will do the normal exercise, do the routine, eat the normal food other patients that are not asthmatic would eat.
Really?
Yeah.
I thought there are some foods that they shouldn't eat.
Food, like if a patient has allergic type, the patient can also go through some allergy tests to know the type of
foods that should not eat. What is her triggers?
What are the triggers are exactly.
Okay.
So if food is not part of it, for instance, the patient can eat anything everybody eats.
Okay, because some people they say, oh, you're asthmatic, you shouldn't eat this, you shouldn't eat that.
No.
It has to be specific.
It has to be specific.
Okay.
For instance, like most triggers are air pollution, smoke. You know, like a patient that smokes, you can actually beg patient to stop smoking.
Okay.
So for those category of patients, maybe smoked fish, for instance, can trigger it.
Smoked fish,
which I doubt. You know, like if smoke is one of the triggers, you know, so anything smoked, like passive smokers and anything, you know, or fried.
So anything smoked, like if you are cooking in the kitchen, like this charcoal fire.
No, the patient shouldn't come near that. If smoke is one of the triggers.
Okay. How can you now say that they can lead a normal life?
They will live a normal life. For instance, there are other things that can be put in place. The kitchen can be well ventilated.
Okay.
You know, and there's this thing that they put in kitchen that absorbs all the fumes.
Okay. Yeah.
So the patient can handle all.
I also understand that there is a long and short short-time treatment for asthma. How so?
It's true. For short-term treatment is given when the patient comes down, when the person comes down with an acute attack.
Okay.
We treat short-acting. That means it will act immediately. The person is administered, the drug is administered to the patient, and the long-term treatment is like a maintenance therapy.
Okay.
To put the patient on, because what we want is prevention rather than cure. So what you do is that you put the patient on long-term treatment, like some inhaled corticosteroids. Those ones.
I don't know. I wouldn't know that one. Please just tell me, what are the best form of control
for asthma?
For asthma, yeah.
Most patients, actually all the patients will benefit from bronchodilators, be it short-acting or long-acting.
What's that? What's
an example of bronchodilators is what I have here.
Okay.
This is the most popular one, Ventolin. It's a 2 agonist.
Okay.
Another name for it is salbutamol. You know, this is actually for treatment, like to stop attack when the patient comes down with attack.
Okay.
Then this might not be used for maintenance.
Okay.
Yes, because it's short-acting. If you need something for maintenance, it has to be a long-acting or intermediate at least, so that when the patient administer 1 or 2 puffs, it can serve the patient for like maybe it's from morning till midday. When the person will put another one, administer another one, which will actually last maybe till night. So the long-acting are actually administered like maybe twice or once a day, while this is for an acute cure. Like the patient has an asthmatic attack now, you really want to help. You put this one because it's short-acting, and again, it acts fast. It starts taking effect immediately in the system, unlike the long-acting. The long-acting, the effect will take on later, we kick off later in the system.
Yeah.
So we don't want the patient to develop complications before you.
Can asthma kill?
Asthma can kill if it is severe one. If the patient has a severe form of asthma, it is life-threatening and it can kill. And ideally these days, no patient should come down with a life-threatening asthma.
Why so?
Because after treatment, the patient is educated. You know,
Doctor, please hold it hot. Let's take a break. When we come back, Dr. Salako is going to show us how to use the inhaler. Stay with us.
Back pain can be said to be a result of wear and tear.
Yeah, that's
Raise one leg up and then try and pull it to your chest. Your head down. Just relax.
Some of these infections, like particularly like tetanus right now, it's something where if the mother is immunized, the child is actually protected for the first 3 months.
Medicine from your kitchen. Today I want to share one tip with you, how you can use your coconut as medicine. Hi, my name is Edak, Willie. If you want to know how to stay healthy and fabulous, join me every week. Welcome back. Doctor, please show us how to do it.
Okay. Well, assume this is an asthmatic patient for now, and she has been having, asthmatic attacks in the past, and at this point, she has come in contact with. We will assume that she has come in contact with one of the allergens that triggers asthmatic attacks in her. So what she would do in this case is that she would reach out for an inhaler, check the expiry date, and she would open her mouth and do these 2 puffs. She can do like 8 puffs in an hour, depending on how she feels. She has come in contact with an allergen. She's beginning to feel tight, chest tightness, and she's beginning to feel uneasy.
So this can be a lifesaver?
Yes. Okay. So this is what she's going to, maybe she just walked into the kitchen or a room that has just been fleeted with an insecticide. What she does, all she needs to do is to just reach out for this, check the expiry date, be sure it's still okay, shake it, then just open it and open her mouth, do 2 puffs like this and inhale it. Okay. That's okay. And this can be repeated like in another 20 minutes. Okay. As a whole, she can even have like 8 to 10 puffs in an hour. Okay. With this, she might not even come down with any attack. With any serious attack. Really? Yes.
As small as this is, it can be a lifesaver. Sure. So, doctor, what advice do you have for asthmatic patients?
Okay, I will advise all asthmatic patients to at least identify all the triggers, in them, and that they should have like a routine clinic visit. Okay. To their caregivers. They should visit their caregivers, if not monthly or 2 months. They can do 2 monthly, and they should adhere to their medications. Okay. Because after the treatment of the acute exacerbations, they are also placed on maintenance medications. Okay. So once they can adhere to those medications, identify their triggers, they can stay symptoms-free for months. Okay. They can stay.
Thank you, doctor. Thank you so much. Thank you for coming.
You're welcome. You're welcome.
We'll be right back. Medicine from your kitchen. Watermelon is very good for the body. One of such things is that it is diuretic. Diuretic means that it takes out water from the system. So if you are one of such people that have this body fat, this kind of fat that is water, water, the first step is to get rid of that excess water from your system before you start losing weight. And doing it in a very healthy way is by eating watermelon. You eat it with the seeds. If you do this one, a slice in the morning, afternoon, and night, you'll see the amount of water that you lose, either by sweat or by urinating. And before long, you would have dropped that water weight. So you now start battling with the fat weight. That's my tip for you today. Thank you for watching today's episode. My name is Edak, Willie. See you next week.